So you started Tru Health a few years now.
Yeah.
What made you start it? Like the name itself says Tru Health, meaning to say there wasn't Tru Health before.
Yeah.
Which is so true.
I suppose not too long before that, what's it been, about 3 years ago, I was working in the A&E department like you, and I could just see it getting busier and busier. I often had to treat people in cupboards because, you know, these people have come in with heart attacks, quite serious conditions, and they're waiting 6 hours. And so I could see that something needed to change. I was studying lifestyle medicine at the time. That's where we met, of course. Yeah. We met at a meeting at a conference, and just the research was so solid that so many of these conditions, the heart attacks I mentioned, diabetes, across the board, so many of these things that people are experiencing, the conditions people are experiencing now, which go on for a lot longer than, for example, infections, which is actually how I initially got into holistic medicine. That's also worth noting is my own health journey with getting tuberculosis. It was just incredible to actually see that okay, if you pay attention to lifestyle and other ways of looking at diseases, then that actually, you can reverse them. And I thought this is the only thing that's actually going to relieve the burden off the NHS. I think we can pour more and more money into it, but we actually need to get people well. And I really started exploring what it meant to not just treat disease, but actually to find true health and what it really is to be healthy. And that connects a lot to, as I said, my own experience of being unwell. Because actually, I mean, tuberculosis is fairly common, right? It's no big deal. You know, that's probably how I got it. I was on elective in Cape Town and just seeing all these patients with tuberculosis. No one was wearing masks. Everyone was like, yeah, latent TB, everyone has it, no big deal.
Yeah, exactly.
What's your, how much do you see it around London?
Fairly more common now than before.
Yeah.
But the other thing what you're trying to say is like most of conventional medicine, we're very good at treating the acute illnesses, right?
Yeah.
The acute is brilliant. I mean, if you go back since the inception of modern medicine, that's what I think. We've done very, very well in any acute care, trauma, infections, acute strokes, acute heart attacks. You take the acuity off, most of the conventional medicine is very good at extending the disease, right?
Yeah.
Or, in other words, to be more blunt, I've only can treat you till I'll give you either a pill or a scalpel till you have the disease. So until then, it's less spoken about, right? That's what we mean. Like we see more of the same disease back and forth.
Yeah, exactly.
Yeah. I remember joking to a couple of the juniors. I said if I do a drug chart for a certain demographic age group of say 10 drugs, and I kept changing the label for the next 10 patients who came in, I'll probably be right for 7 or 8 out of 10 times, right? Crazy,
okay,
right?
Interesting. I mean, I notice that a lot in functional medicine. Because I really love getting into the depth, because we really focus on root causes and why is it this person is getting unwell, and I'll go into all the we do very complex testing and bloods, and really to work out, okay, these are the key systems out of balance, and I'm like, okay, working this whole theory in my head, but when then I come to the advice, it's the same 3 things. Absolutely, this, which is interesting, isn't it? But I'm wondering, that whole pathway, there must be something behind it. I feel when people actually understand what's going on, that's part of the healing process in itself.
100%.
Yeah.
So you said like root cause, right? And that's what functional medicine is, right? Predominantly, not many people know of functional medicine. Right? So tell me more about like the root cause, because correct me if I'm wrong, like at times I believe, or I think, if someone comes in with a disease who's so good at xyloing it off to a specialist, we subset into, now there are about 80 specialties or more in the human body. We know so much about so little part of the body.
Exactly.
And then when you get any condition, we kind of either ship it here, ship it there, but not joining all the dots. And as you rightly said, all of them could have the same root cause, right?
That's where the reversal gets really powerful, and there is so much value of having those specialists in the area. You know, you really you want that input that can be so good with the acute short-term treatment of really supporting a person from not dying, really.
That's
what I found when I was unwell. It's like, okay, if they're discharging you out the hospital, you're pretty safe that you're not going to die anytime soon.
Yeah.
But then you've got to start thinking, okay, well, I actually want to be well. Because if you allow whatever it is that's driving the condition to continue, it generally is going to be this slow decline until something worse appears and I have to come back and visit you or your GP. So when we talk about root causes, so we're looking at how all the systems of the body interconnect. Because if we're asking, for example, why is it that I've had the heart attack, it might actually be that it's something in your gut, that we're eating lots of processed food, my gut's become very inflamed. There's a lot of evidence now that things like cardiovascular disease has a strong inflammatory component. So actually by healing someone's gut, we can reduce their heart attack risk or start even reversing the blockages of vessels.
So that's all like to do with inflammation, right? Everything is root cause of inflammation, and that's that famous quote these days you hear is inflammaging.
Inflammaging, yeah,
that's such a apt word.
It's an apt, yeah, it is, and it's interesting because there's obviously so many different ways that inflammation manifests when we think about how we test inflammation. Your CRP can be totally normal, and yet you can still be like, no, I really do feel there's an inflammatory component here. And I think this really, so inflammation is a very normal response. You have a cut and it's that redness and heat, swelling. That's traditionally what we think of, but the idea is actually when that process of the immune system goes on, it's trying to attack a threat. If that continues, then actually that begins to redirect more of our resources away from healing the body and instead into raising up this sort of hot fighting response, which actually drains us and can damage tissues.
Yeah. So that's the root again, isn't it? So like you're trying to read
so that would be one of the root causes. But there's, I feel I've seen several areas. For example, people also can get very specialized in the mitochondria, so the parts of the cells which generate energy. And as well, I hear them say, like, that is the root cause of all causes. It's all about our energy generation. The heart attack is all going to be like, the heart is rich with mitochondria, right? So you could easily say, okay, I think it's this. And actually, my training in functional medicine does recognize that. So we map everything out in terms of the imbalances onto these various systems of the body. So digestion, immune system, energy production. And often we'll start in the area where we see the most imbalances, but actually it doesn't really matter if you have a lot of experience in mitochondria and you want to start there. What I'm always trying to do is generate this feed forward cycle. So for example, if you sort those mitochondria out, you're generating more energy. Often that can allow a healing response in the gut to then take place. And then that feeds forward to all the cycles interconnect and support each other. I think that's my rationale of how someone can focus in on just one area.
Yeah, of course.
And it seems to do the trick.
So like, we spoke about inflammation, right?
Yeah.
And then you said mitochondria, energy. Every itis in medicine is inflammation, right? Dermatitis and conjunctivitis, whatever itis, endometritis. But then we send each condition to one specialist.
Yeah. Exactly, and you made such a good point that's the amazing thing when you view how all the systems are interconnected, is that by addressing that, supporting the natural healing responses, essentially, you're not just reducing inflammation, you're reducing the heart attack, but maybe also as well you reduce your risk of autoimmunity down the line and dementia. So many of these other conditions can be driven by that same root cause, such as inflammaging or mitochondrial dysfunction. These are the hot ones. What else is hot? I suppose I'm interested as well to learn a bit more about Ayurveda, which, because I think they recognise that in terms of these general patterns in the ways in which the body can start to deteriorate. So whether that is inflammation or immune system imbalances, energy production, digestion, really.
So they give this analogy. They talk about if there's a problem with the leaf, you don't spray the leaf, like you treat the root of a plant, right? But that's what we tend to do. We just spray one part of the beef or send it to this. But the root cause is, as you said.
Yeah.
Even in Tru Ayurveda, they don't talk about different systems. They all talk about you as a whole, because you are one.
Yeah.
So now, instead of everything starts from within you, like one part, and then once it disintegrates, depends on which part of the cell. We have 40 trillion cells, right? A dysfunctional cell in the ovary is different from a dysfunctional dermatocyte, but a dysfunctional cell is a dysfunctional cell. So you want to treat at a cellular level is what's the cause. You spoke about energy. This is amazing analogy that I think to myself, like when you come back and say I'm exhausted, I don't have energy, that's because you just don't have that energy. The way I look at it is every cell or mitochondria makes certain amount of ATP, right? That's the energy.
ATP, like the energy currency.
Currency, right? Currency is this. So you do need the ATP if not you have a dysfunctional cell. And there's only so much of ATP that you make, whatever that arbitrary number is, right? And your body uses ATP wisely. Say it uses it for your main functions first, the main organs, like you say your heart, your brain, wherever, and then it also uses it for your stress response.
Yeah.
Because that's your defense mechanism, right?
And that's a matter of life and death. So it's
it
like,
is, right?
I'm spending my chips there.
Exactly.
That's what matters to me.
That's what matters to me.
Yeah.
So, like, there's 2 points I make when I speak about stress. It's like stress is a good thing.
Yeah.
Stress is a survival instinct.
Yeah.
I know the word stress has a negative connotation. You use the word stress, everybody gets stressed, right? Like, if you have an insect bite, there's a stress response.
Yeah.
You'd be dead if you didn't have a stress response. So your body is sending it to these stresses. The problem, I think, is we have too much of stress that's not even ours. So that ATP production you have is like you're sending it to someone else's. You're stressing about something else that you can't do. Someone else you're doing. You come back end of the day, I'm exhausted. Yeah, you are exhausted. You used up all your ATP.
Yeah.
So use it wisely.
Yeah.
So for me, I use it like a currency. That word you said, right?
Wow.
I only make so much of it, so I'll fight the battle that I think makes a difference, and what is serving me or what I'm trying to serve. So that's the mindset I have, and I'm trying to on a day-to-day basis.
Interesting. I like as well connecting to that unity, and I think there's much more recognition in Ayurveda of like the unity of consciousness and the if you think about, for example, the plant, is it actually an isolated thing? Like it doesn't exist unless there's a soil it grows in, the air that it comes from. And I think we forget that as humans. We actually really rely on our environment around us. And this is a very, very different environment than how we evolved, how our body, what it was used to, the stresses that it had in the past, right? I've been out in the countryside for a while. It's something else coming back into London.
It is, isn't it?
I had no idea. Like the level of like cars rushing by, like constant noise is such a stress. And then, yeah, everyone's sort of like the emotional contagion. There's a lot of people you can see now on the phones. Like there's this real, they're in their stress, and I think you feel that we're all feeling that. I really felt that through the pandemic, that big lift in global stress. Yeah.
100%. Like everybody's just busy being busy. So Robin Sharma says all of us are just so busy. I think last week, a week before, I was just walking past Liverpool Street, and then I just looked at people just busy. I got that on video on hyperlapse, just to myself and thinking like that could be me. You just zoom. So everyone's either rushing to go somewhere or come somewhere. And the same pattern happens tomorrow. You're going back and again. Yeah. And that goes on and on. That could be, I don't know, first week in June 2023. That could be last week. Time just keeps going and going.
Yeah.
Right. It's so fast paced, as you said. And one thing you notice is like everyone's. So we all use a sympathetic breathing for 80% of our lives. So we all just uptight. Crazy, right?
This is a huge one. Oh my God. In terms of like root causes, I feel like breathing deserves a mention as well, because I suppose it very much connects to that stress response, but obviously like oxygen is so important for the function of the body, and this sort of high up in the chest and breathing quite rapidly and under stress, like trying to get more of that oxygen in, and actually that prevents us getting the oxygen to the tissues because of the Boer effect. Do you remember this one? So breathing off more carbon dioxide because you're breathing more quickly, and actually the body relies on that signal of the carbon dioxide to release the oxygen at the tissues. So yeah, I think that's another really key, but it connects to stress, and I think that would be one of my key ones that I...
So you're 100% correct, right?
Yeah.
So if you break down to a cellular level, like what you said, how does the cell or the nucleus make the ATP? So it needs few things, right? It needs the oxygenation, it needs the nutrients, it needs the light, and no toxins or trauma. It gives this. So we're traumatizing it with multiple stresses or edible toxins or synthetic toxins, from 80,000 synthetic toxins that we have. 70% of the time we spend indoors, inside the house, inside the train, inside the car, inside the office. There's no nature.
Yeah.
Oxygenation, that's a huge topic. That's phenomenal, right? And and the nutrients, what we eat is not food. It's not processed, it's ultra processed food.
Yeah.
So you're not even giving it a good chance to make a decent amount of ATP for the cell to do function. And once you even make that, you're using it unwisely.
Right. I mean, this is common sense. With our cars, right? You're not going to just be putting in water.
And then wonder why it's not working.
Yeah, exactly. Yeah.
So with the oxygenation, right, I keep speaking to colleagues at work. All medics, all acute physicians work on oxygen tissue delivery. That's like biggest formula. All bases on that, right? All depends on how much of oxygen is getting delivered to the tissues. Everything works on that basic function, right? So that's why when you go to the hospital, you increase them on oxygen flow from 21% atmospheric pressure to whatever, up to 85. And then it doesn't work, and then you tweak a little bit more, and you put like continuous pressures, or you tweak on your cardiac outputs. End goal is oxygen tissue delivery, right? Think about it this way. So our tidal volume, or the maximum amount of volume one can take completely, is about, say, 5-6 liters, give or take. Even when you and I are speaking, I don't think we're taking a whole breath level, right? We're probably taking just, and as soon as you said it, we'll take home, right? So I don't even know how much we're taking. So let's argue, say, 30% of what our capacity is.
Yeah.
So we do not make basic physiological 1.0 sense that a little bit you take in, only a little bit of oxygenated blood goes from your heart to the tissues. So only 30%.
Yeah.
And it only rations to the parts that is essential first. And then only a little bit is coming out. So deoxygenated blood gets accumulated. You're not even taking the oxygenated blood.
Yeah.
So you've seen babies breathe. They use... and the posture and everything, they've got everything good. Exactly.
Before we mess them up.
Yeah, exactly, right? So you ask a nurse to take a respiratory rate for a baby. She takes the top off and she looks at the abdomen.
Yeah.
The big muscle, the main muscle for breathing is the diaphragm,
and
right?
they're really breathing from the,
And then intercostal muscles, and then the neck. So now we are accustomed to use only the neck muscles. Excellence why we get neck pains and tightness. You're only using the accessory muscles to breathe and not actually doing in depth. That's why I keep thinking breathing is the most important, like step one.
And what's one of your favorite techniques?
So, and because it also does work on your autonomic nervous system, right? Because it's the same way vagus nerve everyone talks about.
Well, I mean, going back to that stress, right? Of like, stress isn't a bad thing. It's like we want to have that balance of stress. And
how do you manage stress?
And then exactly. I suppose that's the long-term stress, so that you're actually reducing it. But one way as well is to expose yourself to more stress. I think really is important, the hormesis, like what doesn't kill you makes you stronger. So short bursts of stress. And I'm interested, I suppose, with going back to oxygen. I feel like that's a potential stressor on the body if you have too much. What's your
So 100%. Anything too much is bad.
Yeah,
for you, right? But I think we're in a state where we're not even getting anywhere close to that.
Right, exactly.
You know
for most people, don't be worried about not getting enough oxygen.
So you're talking about like hyperbaric chambers and then taking more at iatrogenic when you're in the hospital, getting too much of oxygen you don't need to. For most times we don't.
Yeah.
Like, the reason I keep saying breathing is so important is like, you're talking about stresses. If someone came barging into this room now, the first thing, or try to throw something at us, first thing you and I would do is a sympathetic drive goes in and saying, hey Neel, you're going to die, just take as much as oxygen as you can.
Yeah.
And then if that person just chucks things on the floor and starts laughing, you're like, thank God.
Yeah.
Your parasympathetic nervous system takes over, right? So you're exhaling. So I think the first step I keep telling people is to pause from this rat race that we're doing. Just pause. Just pause, meaning how difficult it is for people to just sit in silence.
Well, it is extremely difficult because we feel we're in that survival, like we actually feel our life is at threat.
Yeah.
So it's like feeling like that lion's after us, and actually when you're in that state, it's the most unnatural thing to just sit still. Yeah, and I think we probably are. I definitely wasn't before I started meditating. I had no idea, especially working in A&E. You can't connect to your body too deeply because you are exposed to so much stress. So once I started realizing what was actually going on, it was like, oh gosh, wow, this is uncomfortable. So I think a lot of people probably walk around without realizing quite the stress their body's under.
So when I tell people like you got to pause for a couple of minutes a day, it's at 2 minutes, 120 seconds. There's 1,440 minutes in a day. You can't spare 2 minutes for yourself.
Yeah.
Nothing else. But I'm like, no, I'm so busy. I have no time. Like, all the more reason you should.
Right.
Because you have no time.
Yeah.
And one technique I keep telling people is light either a light. I mean, either a diya in Sanskrit or a candle. Even though I'm not a fan of candle because of the fire lights, and just stare at the fire. Because you think of it, that's the oldest form of entertainment. People just sit around fire, right?
Oh, yes. I get captivated.
It's humanly in nature to get captivated by fire. You can't not.
And waves.
And waves, yeah. and in Ayurveda, that's what they say. Because the fire, anything you take, they're made of 5 elements.
Yeah.
Okay? This is 5 elements. You have different composition, different intensity, different densities.
Yes.
The same 5 elements. Like it's water, fire, air, earth, and space. Right? Which is why naturally when you anywhere in these areas, like you're sitting in nature, by the water, looking at the fire, you connect, your body connects with them. That's how Mother Nature is made. So one of the very interesting ways how Ayurvedic medicine works is you and I can't take the same medicine, you and I can't eat the same thing. So they divide them into what's called doshas, depending on the balances.
Right.
Of these 5 elements. And everyone is different. You can't be the same. Like for same instance, some people commonly get dry skins or respiratory tract infections, or some people get like upset tummies. They're very common entities, but they're not a disease per se. They brush through it, but it depends on your body's composition. So they divide them on that basis first and then try to do treatments. Amazing, isn't it?
It is amazing. I have one particular one. I know Vata imbalance is quite uncommon. So you've got the 3 main ones that your constitution's made up of.
Yeah.
So the Vata,
Kapha and Pitta.
Kapha and Pitta. I often get asked how to calm down my Vata. What's your thoughts on that?
The different ways. Like, I mean, you could divide them on, they're so amazingly connected. So it's not just the diet alone. There'll be diet, there'll be certain mudras, your hand gestures.
Okay.
Because your right and left is connected.
Okay. Have you got one for Vata imbalance?
Yeah, there are many. Like you
Okay.
can structure them out. There are certain chants you can.
Okay.
There are certain asanas. Asana meaning the modern day yoga.
Yeah.
So yoga is not just asanas. Asana is like the postures that you see. That's just one subset of what yoga in real meaning. But that's when I say yoga, everyone thinks of the stretches alone, right? Or the postures. But that's not complete yoga, right?
Yeah.
There's so many parts to yoga.
Yeah. Yoga to unite, or it's going back, I suppose, to... Is that actually... I don't know. I feel like I learned that in my yoga class. I have no idea if that's true.
It's
but
true. Yeah, yoga means
to
like...
yoke.
To yoke, yeah. It's like you're in sync with the consciousness.
So it's realising our interconnectedness.
Interconnectedness, it's me and the universe, both the same kind
Which
of
I must say, if I was going to choose my like one root cause of all things, like I'm only allowed to choose one thing, it would be disconnection. Because there's so many different levels of that. It can be disconnection of cell to cell, which we know can cause cancer, or it can be disconnection from your community, which then puts,
That's why you were speaking earlier, like there's a nice quote about detachment.
Yeah.
Something on those lines. So detachment, normally people think you are away, you have nothing. But it's not true though. Detachment just means you have everything. You just don't have everything controlling you.
Right, exactly.
Okay? So it shouldn't encompass. But when you're in with something, you're with everything.
Yeah.
But that's how we are. We're meant to be free creatures that we're born, right? Just explore. But I am on the path. I am attached when I'm attached. But I don't get attached to that emotion, that feeling, that article, that's the substance. Like, you get attached to it.
More like an addiction.
Yes,
I think
exactly.
a lot of people get very attached to stress.
Yeah,
It feels good.
Yeah.
I've always been like rally racing or jumping up planes.
Yeah, exactly.
I feel like there's dopamine in it.
It does, yeah, it does, isn't it?
So yeah, I was actually in India and I went to see an Ayurveda doctor, and they she actually had me do the questionnaire. Is that the best way to actually tell what dosha you are? Because you can get these for free online to dosha quiz and work out what you are. I, in the past, was more, I would say, like a pitta, but she was like, you're definitely vata. Maybe that's where I was. And she gave me some suggestions. I love like sesame seed oil or just alternate nostril breathing. I find really helpful.
So the different kinds of breath work, right? It's called pranayama. Prana means life. Right. It's quite interesting actually, because I was speaking to a resuscitation officer. If you see a newborn, when they're in the womb, that you could feel the heartbeat, right? You could see it on a scan or whatever. As soon as the baby's delivered and you cut the cord, there's no heartbeat though, because when you do when there's no heartbeat, that's when you're trying to clear the muck and then give rescue breaths to resuscitate.
Okay, wait. But usually babies have a heartbeat, right? When they come out.
So as soon as they come out, once you cut the clamp, they have to take the first breath in.
Before the heart goes?
Before the heart goes.
Okay.
That's the first breath.
Okay, got it, yeah.
So that's the first breath in.
Yeah.
And when you die, it's the breath that goes.
Right.
So you could take it spiritually or just physiologically. We are just a bunch of breaths the whole life.
Yeah.
Right?
Yeah.
And that's why it's prana means life. There's so many types of breathing techniques, and there's certain breathing techniques where you could even gain, apart from just generating heat externally, it doesn't matter, even in snow you can generate heat. There's certain breath techniques that are so advanced that you could get DMT states. Right? Yeah. Because so all these neurotransmitters are already there in the brain.
Yeah.
So when you take an external substance, they're not creating a serotonin or oxytocin. They're already there in your brain.
Yeah.
It just promotes them. It just helps you. So it gives you that state. Like, so when you go out and then let your hair loose or do whatever, so you get into that state. So we go back, like say, for instance, you go to work Monday to Friday, and then evening you want to, on a Saturday, Sunday, you want to go let your hair loose, only to go back and come back again.
Yeah.
Imagine you doing certain practices that you could be in that state all the time.
I'm starting to laugh because I'm having a memory from just yesterday.
Go on.
Me and my friend were in I mean, I love a sauna, but we were going sauna, and she's like an athlete. She pushed me further than I would usually go in the cold plunge. It's ice. So getting to about 3 minutes, I was just getting higher and higher and higher, and we got out and we were just in fits of giggles.
Right?
Wow, like total shift change. Yeah.
So
really
you just get an ice bath, or you did like
it was like we were flipping between them, but it was particularly the ice bath that really felt DMT like DMT go. So I guess that's why Wim Hof has got so popular, with combining cold water with breath. Yeah, that'd be quite a high.
Yeah, that's the what I want to. I was speaking to another friend of mine from Norway. That's what I was saying you should do. I said, do breath work in a sauna.
I have done that.
Do breath work in a red light therapy space.
Yeah.
Do even breath work when you're on hyperbaric oxygen.
It's quite intense though. It's definitely that. You got to find that right amount of stress, right? Where you start overdoing it.
Yeah. I mean, you can figure out for yourself.
Yeah.
Like, you're the one gauge. If you think it's too much, then you know it's too much.
Yeah.
But then you're getting the combined effect of all of them. So I want to chant in a hyperbaric chamber. Because it's vibrations, right?
Okay.
And like when I'm speaking to you,
yeah,
the sound frequency. That's why we're different from.
Tell me, Tell me again. You were mentioning that you tell me about the water. I love this.
So like everything is energy.
Yeah.
Like when I say energy, it's not like some Indian guru sitting in Himalayas and levitating, right?
Yes. Back to the mitochondria, right? I mean, that's another.
Yes.
In functional medicine, that is the key thing they argue is life, is that potential across the membrane of mitochondria, which totally relies on the breath.
It does, isn't it?
Yeah.
That's what I'm saying. So the cell needs the breath.
We need the breath. We need the energy.
You need the energy.
Yeah.
So you can't argue with that.
Yeah.
So the in quantum physics level,
yeah.
I'm talking to you, you can hear me. So I don't know, it's maybe 30, 40 hertz, whatever, or probably more, or decibels. So it's frequencies, oscillations.
Yeah.
Right? So it's going up and down, up and down, up and down. You put a glass of water and you tap the table or the desk, the water sort of vibrates, right? That's set at a frequency because that's sound causing some waveform.
Yeah.
The body is 80% water. So when you listen to music that is pleasing or calm, you have a sense of calmness. So anything between 430 to hertz is what the nature says. There's a frequency already set. Like that's what the nature goes by. And the sound of the waves gives you a calm nature. So I find chanting or mantra meditation the easiest. And I'll tell you why I mean easiest. So these chants are set at a higher frequency, 180 to 100.
Yeah.
So going by the same principle, if I'm just chanting what is already set for me, I'm not doing anything new, I'm just chanting. I know my body is vibrating at the same level. And if I'm chanting with someone else, it's amplified. And if I'm chanting with someone else and they're all clapping and dancing, it only amplifies in a room of people.
Yeah.
It's like a no-brainer.
I mean, you feel it. I mean, we like things we can see, like the water moving.
Yes.
And I mean, I just felt that yesterday. We were at the Kirtan together, and incredible, like such a powerful healing, relaxation response. Yeah.
It is, right?
Yeah.
And one of the breathing techniques, I think, is the chant of Om, or the other version is humming B, it says. Sound of Just close your eyes and just
activating that vagal nerve, the parasympathetic tone, helping to rebalance that stress response. Yeah.
Because the same vagus nerve goes through your inner ear as well. So your ossicles vibrate. So that's why when you listen to sound that is appealing, you feel a sense of calmness, because that vagus nerve gets stimulated and your parasympathetic state, you go into a parasympathetic state. That's why you're a lot more calm. It's crazy, right? So the sound of Om, and in Ayurveda they say it's the primordial sound. And I'm trying to do a bit of research to understand what they mean by primordial sound. For any sound to happen, you need two things to come together. A clap or a knock on something. So it said apparently if you held your tongue and spoke anything, you'll hear O, U, or And that's sort of the beginning of sound. Crazy, huh?
I want to try it now.
Try.
Hello. Yeah. Pin it down.
I only heard them.
I see what you're saying though. I love that it's like, that initial vibration that goes at the Big Bang. You can just imagine that there's that initial sound pulse of things coming into creation. Yeah.
It's crazy, right?
Yeah.
So what sort of breathwork do you do, or you tell your patients? This is another thing I tell, right? I mean, I'm not being horrible, but I'm being honest to all our colleagues per se, right?
Yeah.
We've not taught nutrition in med school, were you? Certainly it wasn't taught in India, and I know it was that here.
One lecture,
yeah, exactly.
1 hour, yeah.
Like as doctors, you don't get taught.
And only about disease. So it's only like if you completely lack this nutrient, you're going to get this disease.
Yeah,
but actually,
deficiency or something will give you this.
Insufficiency, right? If you don't have quite enough, that's also mean the body can't function as well.
That's all we get taught, right?
Inflammaging, yeah.
Crazy, right?
Yeah.
Not much about exercise. I mean, you know what importance of exercise, yes, but in depth is what you would want to have known.
Exactly.
Maybe a few days on sleep, or like a chapter on insomnia and the ones that give you disease
Such a
states.
common thing.
Right?
Yeah, so many people are
And very little on the
suffering
mind.
with this. Yeah.
About mind, mental health, what do you want to call it?
Yeah.
So little as doctors.
And only, I mean, sectioned off to psychiatry. Again, well, this is what I mean. It like really focuses on disease rather than what it is to be well and just experiencing a slight reduction in, for example, my mood, rather than a full manifestation of depression.
Yeah.
And learning how we can better navigate that.
So in the past, Ayurveda had completion of all ancient wisdom. They wouldn't dismiss these are the pillars to start with, right? I think more than in my personal opinion at least, I think more than if all pillars are not the same, I think the mind comes first. It has to come first. You could eat the best nutrition ever, or precisely. You could exercise the most and most efficiently, and you sleep appropriately. But if your mind's dysfunctional, these things take a beating.
Yeah.
Like you don't have proper digestion if you stress.
Yeah.
If you stress, you over exercising, it increases your stress level.
Exactly.
And if you stretch, you can't sleep as well. So I think the foundation is like how you work on your mind.
Yeah. So much about excess stress. I think that's
It's all in the mind.
Yeah.
Like
But we also sometimes fail to recognize that the mind and body are so interconnected, so that actually by working on the body, it can make it so much easier to have a peaceful mind.
Yeah.
If you are someone who's spiritual, want to get into deeper meditative states, it can be so helpful to, have a healthy functioning gut, reduce inflammation.
So they speak about you think, you feel, you do. So it's the mind thinks, you feel as an emotion, and then you act on it. So it's in that order. So you need them to be balanced. But that starts first. It's only when you think, you feel appropriately, and based on your feeling, then you act.
Yeah.
Um,
I'm interested how much that comes into your work in the emergency department in terms of influencing outcomes, whether there's...
So I can only talk from like personal experience.
Yeah, of
Right? I give us a sense of relativity theory to people in A&E if I'm working with colleagues when they get stressed. Because if you ask yourself, is this the worst stress you ever had? Is anything else worse than this? And you invariably get the answer. Especially these days in the NHS and A&E, there's patients everywhere and no space to see, as you said. It's overcrowding all the time. The ambulance are coming. No space for relatives to come in. And if you ask everyone two questions, who would you rather be now, especially if the doctor's poor little patient got no in the corridor, or the relative can't come to see their loved ones, or the porter who's working for far less wage than you but much harder than you are, or what you're doing? The answer is invariably, I'd rather be in my own state. So relatively, you start putting things in a relative fashion, things get better. And then you ask the question, is this the worst stress I've ever had? Like, have I had anything worse? The answer is yes, some has had a lot worse than what you have. Or compare yourself to the other parts of the world where you don't even have a health facility, don't even have a job. They say buy yourself a Costa, you're rich.
Costa?
Yeah, buy a cup of yourself a Costa.
Oh, okay, because you can,
You can afford a cup of Costa. That means you're relatively rich to compared to so many other.
Yeah.
Like you're probably the 5-10% of the 9 billion people across the world.
I suppose it reminds me as well of trauma, and it's not really about what you're exposed to in terms of the stimulus and what you go through. It's about how your body responds to it. And I suppose it's the same with stress. Is for some people, not getting their morning coffee might show up in in as much stress as having a full-out attack somewhere else. Do you know what I mean?
Yeah.
And the other thing, one of my big red flags I always noticed, asking that question to patients, like, how is your stress levels? I actually saw it as more of a concern if it's like, I don't have any stress. Going back to, like I said, because often it's a sign that you're just you're shutting out of your body, and you're not really aware of how much stress it's potentially under. Yeah.
What's your top thing? Do you tell your patients how to de-stress, for instance, or is that I suppose not one fit all, but if you were to give some advice to someone who's stressing on certain things and one thing that they can actionable step to do to minimize the stress.
Yeah. And this, I think, I mean, working on, because I do now work with people on more like preventative, proactive care. And no matter what they show up with, I think it's such an important part of the healing journey and supporting the natural healing mechanisms of the body to create a sense of safety. So reducing that long-term stress, even being one-to-one with a doctor that you trust.
Yeah.
It creates that.
Massive.
Yeah, a lot of trust and safety. There's someone looking out for me.
Yeah.
That human connection, and then it's a lot of the things that I personally have had amazing success with. So whether that's like engaging with nature.
Yeah, it is.
Oh.
It's going back to the same, saying 5 elements.
Yeah.
So when they say be yourself,
Yeah.
means be natural to yourself. The word natural comes from nature. So that's where it comes from, right? Nature. So when you're nature, I am you, you are me.
Yeah.
So we're the one, that's what it says.
Yeah.
And of course, being in nature, you automatically feel in sync, because you are in sync.
And then meditation was a big shift for me. Really, really helpful. I think mainly because of that, building up that sensory map and realizing I had a body. I wasn't just a head walking around. and now it tells me what it needs. It tells me if I'm thirsty or the stress is getting too much or I need to move. So I just feel like I have so much more guidance on what is needed to sustain health. 'Cause people often do say this when they sign up with me. They're like, I signed up because you look really healthy. And and they want to know the food, the supplements. I'm like, it's just I spend a lot of time meditating. I think that's...
But that's exactly the point, right?
Yeah.
So you don't want to go to a hairstylist that you don't appreciate the hair of.
Right.
Why would you go to a doctor who's unhealthy?
Yeah.
So I keep telling my friends and colleagues, if you go and see your doctor, before they give you a pill, say you're not sleeping well or you're stressed and you're going for help, ask, what do you do?
Yeah.
That I can follow, because that's you're going for advice, aren't you?
Yeah.
So same logic. So if they're not practicing for themselves, then why would I take their trust?
Yeah. But I mean, at the same time, the work that you do in A&E, or that so many of my friends do, working in clinics with the real crisis the NHS is under, it is incredible stress, the speed and the expectations, and actually dealing with people's lives. Like it is a very particular form of constant, relentless stress that we're under. Me less so now I'm out of that hospital environment. So fair enough, because I know so many friends who do have such a healthy lifestyle, and I was thinking as well, when I used to do night shifts, I was reading my diary of that time, and oh my gosh, like things like toast and marmalade suddenly just is the most tasty thing in the world. Whereas now I just have no interest in that.
No interest in them.
It's so like the environment and the stress just really influences all of, like you said, I suppose. Well, you said, was it think, feel, do?
Yeah, that's what your mind is, right?
Yeah, but it's almost as one before think, which is maybe the energy. Maybe it's your environment and what you're being exposed to, and that
you're
influences
just doing it, not
what
thinking.
you think, and then
Yeah, in that order. But NHS is it's not the same as it used to be. Right? It's so evident, right?
Yeah.
I think at the inception was a beautiful thing.
Oh gosh, I mean,
like free for all.
Yeah.
Like health for free, it's like a birthright.
Exactly.
Right? So hence it was the envy of the world, right?
Yeah.
Especially coming from India, people save money for that one rainy day where you've got to go to the hospital.
Yeah.
Here, it used to be a stub toe, paper cut as well. You come to hospital, or you could come, or an acute stent put in, whatever.
Yeah.
Everything is taken care of, right? But it's not the same now. And then when you pause and you think, like when I came to the UK literally 20 years ago, the population was 58 million. Now I think it's something on the lines of 68 to 69. There's 11 million increase in population, right? You don't need an economist to tell you this. Can you think of one new A&E or a hospital being built across the country? I don't mean merging. I can name half a dozen or more that are closed.
Yeah.
True?
And losing so many doctors, the up and up, the numbers are going in terms of doctors going elsewhere in the world because the conditions we were often just left as a junior doctor in your first few years looking after the whole hospital yourself, and really not getting paid enough when you look to other countries.
We're the worst in Europe itself. We're the worst doctor-patient ratio.
I can say this now. I'm basically in private medicine. Like, you are not getting paid.
I know. The pay scales are the same, right?
Yeah.
Pay scales are the same. The working conditions are worse. Yeah. Think about it. Like, well, back then, you couldn't get a job in A&E unless you did 2 years of hospital medicine. Only then you can apply in A&E, both a doctor or a nurse.
Yeah.
Right? A newly qualified nurse would never get a job in A&E unless she's had 2 years of experience. Same with the doctor. Now, 2 days in the country, you can put a garland on them and say, please come and work. Right?
Yeah.
Not just being junior, because, as you said, everyone is leaving. So why is it more stressful now than ever before? I even question this. Yes, we need wellness centers and sort of like psychologists in hospital now to take care. We didn't have them 20 years ago. Why now? So it's not people have changed, the conditions have changed for people to react accordingly.
It's almost like it's become too much of a success that we're over-relying on that. And oh my God, I feel the emotion there. Like, we cannot lose the NHS. Like, it's
so when you say lose,
such a valuable thing. Well, for it's on its knees. I just mean, like, it literally is about to need you to come resuscitate it, right? It's really breaking down into pieces. I don't know what takes its place, but it's not going to continue on in its current form, because we've seen the stats as well of all these long-term illnesses are getting worse. Things like, the diabetes, heart attack, across the board. And as well, I worked in GP for 2 years. It's almost like there is a loss of community, things that you maybe would have previously gone to even your neighbour for, or like someone that can really hold that space that I said that really is healing, of someone really listening to you. Speaking to my friend yesterday, who's a GP, this person had been in and out of the GP practice for almost a decade with the same issue and nothing helping, and you get that 10 minutes. So of course it's like, okay, quick response. And she just sat with this person and just listened for a full hour. And this woman had so much going on in her life. And she called the next day and it was like, my headache's gone. Do you know what I mean? Like people need that. We need that as part of the healing response, to feel really listened and supported. And often that helps us to make our own connections of like, oh, actually, I think I need to do this. And actually that can be the one thing that lifts it.
That's what the GPs used to be, right? Family doctor, meaning I knew you.
Yeah.
Like, I do home visits. I knew everything about you. I still know what happens next. So I know. And then you could relate to me.
Yeah.
And now you get 10 minutes and one symptom alone. It's not the GP surgery's fault. That's how the management or the organizations have said that's what you get, because it's all number game.
Yeah.
It's all a number game now, right? We live in a capitalistic world.
Right.
So if you ask a 5-year-old, what does a hospital look to you? He's going to sketch some kind of a building with a cross on the top, then some kind of a hospital bed with a doctor and nurse looking at it, right? There's no new hospital being built. We have huge shortage of beds, less of doctors and nurses. There's no doctors, there's no nurse, less doctors, there's no beds, no new hospitals. Where's this 200 billion going? It's a different question to ask. In my viewpoint.
Yeah,
it's
there's that side of it as well.
Because, to be absolutely blunt, honest, in my opinion, the intent is to privatize, and 80% is already private.
Well, that was... a lot of people thought that that's what they're trying to do.
All you got to do is look at it in detail.
Yeah.
Like, well, I understand sort of from the governance point of view, it is beautiful at the inception. Now we live in a capitalistic world. It's a lot of money for the insurers to take control of the NHS, but I can't say it publicly, so I've got to attack it by stealth. Let me give you an example, right? I'm sure you know, in the hospitals, people who work in the NHS will still know. In the past, your car park used to be free. First, all the non-clinical went private. So now that's taken over private. So real estate became private. Means you have buildings within the hospital premises that are taken over by private entities. It's sold, right? You should get free accommodation for first-year doctors and nurses. It's unheard of now, because that's been sold off, right? Like, your portering system is private. Your Soroxo is private. All this is to be run by them. I can go on and on in detail now how the clinical part is getting privatized. But that's what the intent is, right?
Yeah.
I know it's getting to the American model.
In which case it becomes profitable to have disease, essentially.
Yeah.
Which I love this. Is it China where you used to pay your doctor when you're well?
Yeah.
And it suddenly goes free when you're sick.
Amazing, right?
Yeah, that's what I want to incentivize. Well, I mean, that's partly why I found Tru Health, is because I really believe that we need a model to run alongside the NHS. As much as possible, keep that, to go see you in A&E, unless it's social, that's got to be last resort, right? That is as much as we can, because it's not the most healing environment. It needs to be sterile, there's that absolute lack of nature and light and strong drugs. So we need something to run alongside that really does take this approach to health, which is more preventative, keeping people well, helping them to support themselves, I guess. So
what's your normal kind of patients who come to you? People who sort of want to fix something, or people who want to better themselves, or a bit of both?
It's more people that do have something that they want to address. I'd say probably about 20% of people are more on the longevity, really care about their health and are willing just to get to know their bodies better and how to support it. But particularly when we're young, it's that kind of, we feel we're infallible, or there's other things which take priority. It's actually very unnatural for us to care unless there's something that happened. And I'm so in that bracket, right? It's only because I got tuberculosis and thought I was dying that it's I realized, okay, I really care about my health. I want to change my lifestyle. It became very important, and I still regularly reflect on death just to keep that going, because you need some sort of, almost like a little bit of fear can be quite helpful.
Because that's certain, you like it or not, right?
Death.
Yeah. That's going to happen. So it's not.
But the timing's not, and I love life, and how you
should,
how you die as well. I want that off the cliff, bang, gone.
Exactly. Everyone wants an easy death.
Which most people aren't getting. We're dragging people's lives out. Very uncomfortable states, and that was another big passion while I was at medical school, was helping people to better explore death and the dying process and how they relate to it. One is because it's a big barrier when you do get unwell, that the mind goes absolutely nuts with trying to fix the problem, loads of stress hormones released, and actually that gets in the way of your body actually naturally fixing it.
See, that's what they say, right? A sick man has only one dream.
Sick, one dream, what, to be well? Yeah.
And
once that's there, everything else.
So
you don't realise
you don't know anything else. And that's what you're saying earlier, when you're young, you just think you're invincible.
You're going to be fine.
Yeah, you're going to be fine. There's this nice quote that said, if the young knew and the old could.
Right, yeah.
Good, right?
Yeah. So people do end up coming with conditions. I see a lot of, it's the ones maybe that do get attention, a lot of digestive imbalances, autoimmunity, which is really,
same bracket again,
up,
inflammation, autoimmune.
Yep, and
that's
amazing to me. Just these ones which you can reverse so quickly, and that's not even taught that's possible in medical school. It just blows my mind.
Yeah, that's exactly. That's exactly.
It's just here's your lifelong medication. It's going to slowly deteriorate, and you'll need more and more and more.
So the health industry works only if you're unhealthy.
Yeah.
Right, because otherwise I've got no role for you, do I? No.
Yeah.
So that's how the system works. We rarely talk about, as you said, the root cause or how many things you could do to prevent it. I think there's a bit of a paradigm shift, as you said, after COVID, in people's mindsets, and even in the medics as well. You're thinking that there's so many other ways you could treat, and it's a good paradigm.
Yeah, it's changing.
And I'm very, very bullish about AI in health. It's going to phenomenally change things.
For sure. I'm seeing it already. People are coming with their GPT plan, shall I do this, doctor?
It's crazy. Imagine all the health data and then the points, you can mix them together. You have so much of stuff, data points on your watches these days, your VO2 max, your heart rate variability, and then imagine dotting all your gut microbiome to certain conditions. Imagine all the research papers that are going to take away so much of the time in condensed form.
Yeah.
Particularly, I think it's going to be amazing.
I mean, this is why we have the specialties. It's because one human brain just simply can't learn that much information.
Exactly.
And even if some incredible people could, the speed is now changing.
Yeah.
The speed at which we're learning new things is just, it's kind of blowing my mind.
Yeah.
Because it's what's even true? Because I've learned something 5 years ago.
And it's not true anymore. Yeah. Things
So
change,
it
right?
really makes you quite humble, actually,
Yeah.
which is an interesting in the role of the doctor, because also I think having that confidence to be like, no, this will make a big difference, does actually improve outcomes. It's that
100%.
placebo effect, which adds even more to the actual effect of whatever you're suggesting.
The placebo effect again. The mind.
The mind.
The mind, isn't it? Yeah. Fab.
Right, I don't know how long we've been talking, but I guess
We
we'll
can
wrap
stop,
up
we can
and see
talk.
how we're doing. Great.
Good one.
So fun.
Jesus.
Stop. Oh, perfect. 55.